Hello, my name is Crystal Lim, and I'm a registered nurse. This is my first semester of Master's of Science of Nurse Practitioner School at Franklin University. During this presentation, I will be talking about the advanced practice role for the psychiatric mental health advanced practice registered nurse in a primary therapy practice. Definition of the PMH-APRN defined by the American Psychiatric Nursing Association is: psychiatric mental health advanced practice registered nurses offer primary care services to the psychiatric mental health population. PMH-APRNs assess, diagnose, and treat individuals and families with psychiatric disorders or the potential for such disorders using their full scope of therapeutic skills, including the prescription of medication and administration of psychotherapy. PMH-APRN delivers holistic, personalized mental health care that integrates biological, psychological, social, and spiritual elements to treat the whole person. They teach people how to manage their mental health and improve their overall health. They emphasize the importance of health education, wellness promotion, and prevention of disease. They offer integrative care for the mind and body. They can care for the patients throughout their lifespan, and they're able to manage short-term and long-term mental illnesses. A few of the daily direct care activities that the PMH-APRNs provide are assessment, diagnosis, and treatment for psychiatric and other mental health disorders. They have the ability to order and interpret diagnostic tests such as lab work, provide psychotherapy for individuals, groups, and families using evidence-based practice frameworks, doing counseling, individual or group therapy. They can do prescription and medication management. They collaborate with physicians and other healthcare professionals to help meet the needs of the patient and the families, helping to coordinate patient care and offering referrals such as to case management or inpatient rehab programs. They evaluate as the patient recovers and progresses. Reevaluation and re-envision of the treatment goals plans is needed. Collaboration is the use of teamwork and partnership with other providers and supportive resources, such as the supervising MD, other psychiatrists, other NPs or PAs in or out of the place where you currently are working. They can be others within the specialty organizations that you belong to, trusted mentors, caseworkers, social workers, occupational therapists. They can collaborate to gain knowledge in the areas they may not feel comfortable in or that are out of their side of their scope of practice. They can get referrals for patients, also collaborating with the patient and family to find the best plan of care that will suit the needs and wants of the patient. According to the table 12.1 in our textbook, the benefits of collaboration include improved quality care, increased patient satisfaction, improves the patient outcomes, the patients feel more secure, cared for, closer to healthcare providers, empowers patients to become team members in their own care. And this is all specifically important when working with the PMH-APRNs in their care. Our textbook defines coaching as a partnering with patients in a thought-provoking and creative process that inspires the patients to maximize their health potential. Guidance is the provision of help, instruction, or assistance, in this case provided by the nurse practitioner. Counseling empowers patients to accomplish their mental health wellness goals. Using all three of these, I think that this is one of the most important aspects of the PMH-APRN. The NP is working with the patient to promote symptom stabilization and recovery. It's essential for the NP to build trust and rapport with the patients and family. This will aid in a positive recovery. The patient needs to feel like they can trust and rely on the NP, especially when dealing with a potentially sensitive mental health issue. The more that the patients and the NPs work together and trust each other, the better the outcomes. Some patients have reported that they could relate more to the NP, felt less intimidated by them, felt more comfortable, and had more time to talk with the NP about symptoms and concerns than they did with the MD. This helps in forming a good partnership with the patients and families. Nurse practitioners in this area can also offer many intervention strategies to the patients, such as crisis intervention, relaxation techniques, stress management, and group or individual work. To include the 4 A's of the coaching process here because I believe that is a big emphasis in this role of the PMH-APRN. I'll give examples of how this would look during a therapy session, and our book talks about this in Chapter 8. During the agenda setting, during the session, the patient can choose the topic and the NP can set a time frame for the discussion and provide structure to the topic. During awareness rising, the nurse practitioner can ask powerful questions to challenge the thinking of the patient, letting the patient do most of the talking. Actions and goal setting, by helping the patient brainstorm ideas to help them come up with goals to help better their mental health, the nurse practitioner can challenge and encourage the patient to do more to help reach that goal. And accountability, the nurse practitioner can help the patient achieve these goals by offering resources that may be beneficial and offer follow-ups to check in on the patient and on the progress. Leadership opportunities for the PMH-APRN can be patient-focused or organizational system-focused. There's 4 types of main leadership that the APRN can include, and it's clinical leadership, professional leadership, systems leadership, and health policy leadership. Clinical leadership, you can propose and implement strategies that improve patient care, such as finding new evidence-based practice that works well in your clinic or your practice, a new medication that can be useful, advancing their clinical skills by continuing education specific to mental health, attending courses and conferences about advances in mental health care. Professional leadership, you can take active roles in professional organizations such as the American Psychiatric Nurses Association. You can be involved in local or state nurses organizations, becoming involved in committees, boards, councils that are specific to mental health. Systems leadership, you can take a lead task force to help solve some problems noticed in the area of practice that you're working in. You can work with other support staff in the practice to help the office move smoothly and have good patient satisfaction. Health policy leadership, becoming involved in health policy, political health advocacy, especially focusing in the areas that affect mental health nursing. Stepping up and leading is important in the role of the APRN. It helps gain professional advancements, advocates for fellow nurses, nurse practitioners, or especially for the patient population to help make a positive change within the practice. It provides nurse practitioners with the latest up-to-date information and evidence-based practice. Thank you all so much for being a part of my presentation on the role of the Psychiatric Mental Health Advanced Practice Nurse, Registered Nurse. I hope this helps you understand the role a little bit more. Thank you.